Hello. Just kind of waiting to get up around 100 and then we'll go ahead and get started. Hi. I don't have just too much today, but just a couple update things that you'll see at 4 o'clock. And just kind of talk about that a little bit, and then maybe answer some questions if there's anything in the comments that are coming through. So we'll go ahead and get started. I don't have just too much time today. Today's board meeting day, so we'll be doing that here in just a little bit. Our cases right now are at 40, so that's 2 new cases since yesterday. We had those reported today, and you will see that in the 4 o'clock update. These 2 cases are both associated with an outbreak in another county, and they're currently under active investigation. I want to point out a couple of things that have been questions that have just come through over the last couple weeks. So out of those 40 cases that we've had since March the 22nd, we've had 4 of those that have been asymptomatic. And so that's really important when we think about masks and all of those preventative, things that we talk about every week, and that you're seeing in the news and pretty much everywhere right now. It's really important that we continue to do those things, because even when we think we're not sick, we could be sick. So that's really important. So 4 out of those 40 cases have been asymptomatic. I also just wanted to point out too that, over the last few weeks, I think last week we ended the week at like 35. And so we've gotten some cases over the last few weeks. Most of those cases have been contacts to other cases, which is good news because, that means that we're not seeing this active, widespread issue in the community. But again, we want to continue to be vigilant because the likelihood is that there are cases out there. So we need to treat it like there are cases out there and continue to do those preventative measures. And then we had a case that was also associated with travel recently as well. Just want to kind of go back to the things that we've been talking about frequently, but wearing a mask in public settings, especially where social distancing is very hard to maintain at all times. So we still recommend masks. Children under 2 years of age should not wear masks. There's some other information out there about persons with breathing issues and things like that. If they can't wear a mask, that's all right, but that makes it even more important for the rest of us to wear a mask, because likely they're at risk for severe disease from this. And that's where, when we talk about population health and public health, it's not as much about the individual as it is about other persons, and the things that we're doing can protect you, but it also protects the people around you. So it's really important. And then of course, social distancing, we've talked a lot about that. And that really is that 6-foot distance between you and other people, or your family unit and other people when you're out grocery shopping or spending time in a public setting, that type of thing. And then of course, hand hygiene and those hygienic practices. We have not seen phase 2 of the governor's plan. I haven't heard anything about that. That is supposed to go into effect on Monday, and we have not heard anything yet. I expect that we will probably hear something, I hope today or tomorrow, but we haven't heard anything solid yet around phase 2. But I expect that a lot of these recommendations will at least be in place as recommendations: social distancing, hygienic practices, those types of things. And of course, staying home when you're sick. But again, we know that asymptomatic spread is becoming more of a focal point of the response in general. And we're learning more about those asymptomatic folks and how they spread disease. And so again, it's even more important to do those preventative measures. I want to talk a little bit about the testing events, because testing has been a huge issue that we've talked about week after week after week. And, we've tested in the county, not we, I mean, St. Francis County residents They have been, there's been over 1,400 that have been tested at this time. I was looking at the numbers earlier, but they were working on them. So it's getting better, and we've looked at some of the daily amounts, and it's getting better, but I think we're going to continue to see that capacity increase. We know that the state is doing some testing in congregate facilities across the state and in our area. And so it'll be interesting to see the data that comes from that. And so you also know, we've shared this on our Facebook, but there's some testing sites happening across the state in the next few weeks that are going to be open to the public. So the ones that, you know, might be more relevant for St. Francis County residents are Jefferson County is having a testing event on June 1st and 2nd from 7 a.m. to 7 p.m. And this is on our Facebook too. And it's at the Faith Community Church in House Springs. And then June the 3rd from 7 a.m. to 7 p.m. at the Hillsborough Civic Center in Hillsborough. And we'll share this again after I get off the live. And then there's also one in Cape County that may be of interest to people who are here locally, and that's on June the 5th from 7 a.m. to 7 p.m. at Arena Park in Cape Girardeau. But there are some testing events taking place. There is a way to pre-register. You don't have to have symptoms, which I know kind of sounds a little strange because it's different from what we've been saying as far as not needing to be tested if you're asymptomatic. But these are community testing events, and so they're really trying to find out what is the prevalence of disease at this point in time in the community. And so you don't have to have symptoms. If you want to be tested, you can. So those are some things that are available to you as the public. I know they're not here, but these are the testing sites that the state chose to try to get a good population, a good data set. So I will post the information to that after the live. And I think that's all I kind of had as just some kind of preemptive type of things. I'm just gonna scroll back through here to try to hit some of the questions, if there are any. So there's a question about new cases. So how it works with new cases, they are isolated when we find the case or when it's reported to us. We call the case, we talk with them about what isolation means. And so yes, those cases have been isolated. And then we do the contact tracing, and we've talked about that a lot. So who those folks have been in contact with, and then that's when we quarantine those contacts. Just trying to scroll back through here. Do you expect a big increase since the holiday weekend? You know, it's hard to say for sure. What I'll say is other communicable diseases, this time of the year, it's not abnormal to see salmonella and other gastrointestinal type of illnesses because of people doing barbecues and things, and maybe food gets set out for too long, those types of things. And then you tend to see these kind of clustered events because, you know, people are in a close area together, or they're sharing the same food when we're talking about salmonella. So it's not uncommon to see an increase in communicable disease after we've had holidays. Same with in the wintertime, we do tend to see upticks in flu around those kind of holiday times when people are gathering together. So I don't think that it's impossible that we're gonna see an increase from the holiday weekend. I hope that people are doing their best when they're gathering with their family, or they're trying to kind of start doing some normal things to kind of prevent that. But it's certainly possible. Of course, you know, when we get data as far as, you know, if some type of transmission hypothetically happened over the holiday weekend, we're probably not going to see that for a couple of weeks when people get sick and get tested, and it takes some time for testing to come back. But it's always a possibility. We didn't see a huge spike after Mother's Day, and so that's a really good thing. And we really have, of course, we're at 40, but we haven't seen this spike in community transmission. You know, a lot of these cases have been contacts to other confirmed cases, and that is, you know, expected to happen, that we're going to have that. And that's, you know, a good thing in the way of us being able to quarantine them and know what their source is. So we haven't seen this huge spike in community transmission, and that really is because, you know, a lot of people are trying to do the right thing and trying to do those preventative measures, and are really doing the best we can. So just trying to scroll back through. Have we had any cases in nursing homes? So sort of, and why I say sort of is because you may have seen the Camelot's press release. There is a person that, this is in the Camelot press release, so I'm not telling you anything that I can't tell you, but there's a person that works there that has tested positive. However, they have not worked in over a month. And so it's really not associated with the nursing home, but they've made the decision to test the entire facility. And again, this is in a press release from Camelot. You can see that on their website or on their Facebook. So you can take a look at that. But the good news is that that person didn't work while they were sick or even in the realm of when they would have been infectious. So. Okay, just kind of trying to scroll. So it's asking about, this is a question about asymptomatic folks and why were they tested. Again, the asymptomatic people are persons that are associated with outbreaks in other counties. And so, you know, a lot of times when there's an outbreak in a facility, they test everyone regardless of symptoms. So that's what I would say to that effect. I work in the public at a convenience store. If there's a positive case, we're to say they frequent our store, would we be notified? So the persons that are notified are people that are close contacts to that person. So you have to be within 6 feet of a person and you have to be with them for 10 minutes to be considered a close contact. So if you were named a close contact to that person, then yes, you would be notified. We currently do not have, I see somebody's asking about hospitalized cases. I'm just looking at my time here. We currently do not have anyone hospitalized. Out of our 40 cases, 7 have required hospitalization at one point during their illness. So, but no one's currently hospitalized. Is there a reason a community testing site hasn't been set up in St. Francis County? Has the health department requested this service? So the testing sites that you're seeing that the state is implementing, those were implemented by the state. They pick those sites themselves. As far as testing a like drive-through site or something specific in the county like that, we have a list of all of the doctor's offices on our website that do the testing. It's not really something you can request from the state. They pick the site. And just speaking honestly, the health department does not have the capacity to test large scale testing in the community. That's not to say we won't ever test, but you know, we only have 4 nurses that work in the facility that are in our nursing services area, and those are the people who investigate disease. And so we just really don't have the capacity. We also don't have a healthcare provider on site. And so there's a lot of things around that, but we do have a list of doctor's offices that are doing testing on our website. Just trying to go through. Yeah, I see somebody referencing the one in Deloge. So that's also on the website. I just have a couple more minutes and I've got to hop off here. I'm sorry. I did answer the question about nursing homes. So if you will go back and watch the video, but the answer is no. We don't have any directly associated with nursing homes right now. And you can go back and kind of watch that. If that's the case, I'm reading in a comment, if that's the case as far as notification, then when someone was found to be positive, all the close contacts with this officer were not notified, law enforcement officer. If we are given a list of contacts by the case, and if they were within 6 feet for 10 minutes, those people were notified if they were given to us. So that's how investigation works. If you're within 6 feet for at least 10 minutes and they give us your name or a person's name, we reach out to that person and notify them. So if you think you've been exposed, again, I can't talk about specific cases, but if you think you've been exposed, you can always call the health department. And that kind of brings me back to kind of something else. You don't have to wait until you have a live, and I'm going to be decreasing the lives because just the audience is dwindling and I really got to hop off here. But we want to make sure that they're beneficial for everyone and make sure that's a good use of time. So next month we're going to be going down to 2 times a month, so every other week, but I will do one next week. But you don't have to wait until live to ask a question or to reach out if you think, you know, you've been exposed or something like that. You know, call us. The nurses are always happy to talk to you. We are super busy right now, but you know, reach out to us and we're happy to answer questions about how investigations happen and what is the process. Again, we can't talk about specific cases, but if you're sick, if you think you've been exposed and you're sick, you know, you need to call your healthcare provider. So. Alrighty, I'm gonna hop off here. Actually, we're kind of to the end of the questions anyway. Again, you know, feel free to reach out to us if you have any questions going forward. And I will be on next week on Thursday at 2 p.m. But next month we're going to go down as far as the lives. And if we need to scale back up, we can always do that in the future. But just want to thank you for everything you're doing in the community to help prevent infections in the community. It has worked. And we just have to really stay vigilant as things open back up and we start to, you know, revive the economy and things start to head back to somewhat of a normal life. You know, we need to continue to be vigilant, and we appreciate everything that the community's done, because it really takes all of us. It's not anything that any one agency is going to be able to do. It takes everyone. So we appreciate it. Thanks.